On Monday, Novo Nordisk's Wegovy GLP-1 pills hit the market, marking a notable advancement in weight loss management. The pills also come at a significant price cut from GLP-1 injections, making weight loss more accessible for patients. Nurse practitioner at St. Joe's Hospital Weight Loss Center, Christy Miller, joins me now to discuss the new medication. Christy, thanks for joining me.
Thank you for having me.
Appreciate it. So let's start with comparing the two versions. We have the Wegovy pill and, of course, the injectable. What are the two main differences between the two?
The main difference is that the injectable is a once-a-week injection. The pill is an actual daily medication that you have to take every day.
Is there more room for error with the pills versus the injectable that we've found?
There is. With the injection, it needs to be taken the same day of the week.
Okay.
However, the time doesn't necessarily matter, and it can be taken with or without food. The pill has to be taken at the same time every day with a small amount of water, and there's also no eating, drinking, or taking any other medications for 30 minutes after you take that pill.
Do the two medications have a similar weight loss margin, or is there a pretty big difference there?
No, they're actually pretty similar. So
Okay.
studies have shown between 14 to 17% of weight loss over the first 16 months of use of the medication.
I want to address the cost, because obviously that's going to be a big thing here. The 1.5 milligram starter dose of the pill, $149 a month without insurance. Injectables about $300, I think, $49 out of pocket. The prices can be as low as $25, though,
Right.
with insurance.
Sure.
Obviously, lower costs help accessibility for patients,
Yes.
right? That's what this is all about.
Correct. And with the pills, it is easier to produce at a lot less expensive of a cost than the injectables, and so it's also going to be more available for patients to get as well.
Are we finding more patients are paying the out-of-pocket, or are they under insurance?
My experience is that patients are paying out of pocket more for the medication.
Yeah.
It is limited as far as insurance coverage and which companies cover. Currently, no Medicare or Medicaid coverage for the medications for weight loss.
If someone's interested in using a GLP-1 for weight loss, what guidelines are in place to be accepted for the medication?
The first thing is BMI, body mass index. So a body mass index greater than 30. You can decrease that limit to 27. So BMI index of 27 or greater if a patient also has other comorbid conditions, diabetes, heart disease, high blood pressure, sleep apnea, things like that.
On Wednesday, researchers from Oxford University published research that showed that there was rapid weight gain after people came off the medication. Is there any sort of comprehensive approach for people when they do come off to try to keep that weight off?
Absolutely. So even initiating the medications, the patient should also participate in a healthy eating plan as well as physical activity. And so when a patient either has to come off, decides to come off the medication, they still should be maintaining the healthy eating and physical activity component. Some patients, and this has been out for a while now with the GLP-1 injectables, we can get a patient to their weight loss goal and then sometimes just back down their dose for maintenance and kind of stay on it for right now.
I was going to ask, it's short term, or can it be a long term thing?
It can be a long term thing for sure.
Okay.
For sure.
And that's like you said, back it down so where it just sort of helps.
Right. To maintain. Yeah.
To maintain.
Correct.
Because what does the drug do?
So the drug actually helps to decrease the food emptying out of the stomach. It slows it down, and the patient feels full longer, and it also helps to decrease appetite.
Okay.
Yeah.
Interesting.
Yeah.
Do you think with the pill, and I believe Eli Lilly is coming out with a pill, you're going to see more people jumping on this?
Oh, correct, for sure. Eli Lilly also has an injectable weight loss medication as well. So the studies are still out on that one.
Yeah.
It's not out yet, but we'll learn more soon.
Well, we appreciate it. Christy Miller, thanks for coming in.
Yeah, thank you for having me.